Close to 1/5 of Americans in this age range have heart disease, compared with 1/10 of Europeans, highlighting a significantly higher prevalence of cardiovascular conditions in the U.S. compared to Europe. Between 1970 and 2022, the United States experienced a remarkable decline in deaths caused by heart disease, thanks to advancements in medical treatment, improved emergency response systems, and greater public awareness of cardiovascular health. In 1970, the age-adjusted mortality rate for heart disease was 761 deaths per 100,000 people, indicating a very high national burden. By 2021, decades of progress had reduced this figure to 258 deaths per 100,000, marking one of the most significant public health achievements in modern U.S. history. However, in 2022, this positive trend was interrupted by the lingering effects of the COVID-19 pandemic. That year saw a sharp spike in cardiovascular deaths, with a total of 941,652 people dying from cardiovascular diseases. This increase is attributed both to the direct effects of COVID-19, which can harm the heart and vascular system, and indirect factors, such as delays in seeking care, disruptions in routine checkups, reduced physical activity, and worsening control of chronic illnesses during the pandemic. Several risk factors have been steadily rising, contributing to the resurgence of heart disease in the U.S. Hypertension. Poorly managed blood pressure remains one of the top drivers of heart disease and stroke. Obesity. The ongoing obesity epidemic has significantly increased the risk of cardiovascular complications, including heart failure. Diabetes. Rising rates of type 2 diabetes, closely linked to lifestyle factors, further increase cardiovascular risks. Looking ahead, the prevalence of heart failure is projected to rise sharply by 2030, 2040, and 2050, driven by an aging population, unhealthy habits, and the lasting effects of the pandemic. This growth will likely place unprecedented pressure on the U.S. healthcare system with increased hospitalizations, treatment costs, and mortality rates. The U.S. achieved extraordinary progress between 1970 and 2021. The recent reversal of this trend highlights the urgent need for comprehensive public health strategies to address hypertension, obesity, and diabetes. Without decisive action, cardiovascular disease will continue to be the leading cause of death, and its prevalence will rise even further in the coming decades.